Right. Morning. Thanks for having me here. And I'm really glad to talk about elder abuse in Asia today. So this is an outline. First off, I'll talk about the aging population and how Asian people define elder abuse. Then will be a review on the estimated prevalence and how victims respond to elder abuse. And finally, I'll look at the legislation and intervention efforts that try to combat elder abuse. So by Asia, I am actually talking about Japan, South Korea, the People's Republic of China, Taiwan, Hong Kong, India, and Singapore. So it's obvious that population aging has been and will continue to be a major issue for Asian population. So it was estimated that between 2000 and 2050, the people aged 65 or above will increase by 314%, amounting to 857 million. So this is graphic representation of percentage of population age 60 or above, as have been mentioned earlier this morning. So even if the rate of elder abuse remains stable, we are talking about a lot more people getting abused with that aging population. So while the WHO definition and a type of abuse has generally been accepted in Asian population, Asian people do define elder abuse differently. And most of the studies I reviewed on this slide came from the qualitative studies of older persons themselves and from home care workers who spend extended period of time with these older persons. As have been mentioned earlier, disrespect is a major, they see disrespect as a major form of elder abuse, and so is being ignored or being left out in family gatherings or functions. And family gatherings are particularly important for Chinese elders. Most of them regarded not being able to see their relatives and being treated as if transparent in the family as elder abuse. And Indian believes that being unable to live with dignity and being used as domestic help as elder abuse. And for Japanese elders, being blamed for what happened in their adult children for their own problem is a significant form of abuse. And Korean culture focuses more on the relationship between in-laws. So insufficient attention or open disagreements from a daughter's in-law is considered elder abuse, and so is being, yes it is, and so is being sent to an institute and lack of financial support to older persons. So as it's obvious, there are huge variations observed in the estimated prevalence of abuse, mainly coming from the different instruments that we use, the different sampling method that we use. And the overall prevalence rate ranged from 6 to 44%. And the more common forms of abuse are psychological abuse, ranging from 4 to 27%, and neglect, ranging from 3 to 20%. And abandonment and sexual exploitation are relatively rare. But then I want to point out there's a potential bias here. First off, we may not be able to assess older persons who are abandoned. And then while elder abuse is a taboo issue in Asian population, and so is sexual issues. So older persons who are victims of sexual abuse may be really reluctant to admit that. And this is the graphic presentation of the rates of elder abuse. For self-neglect, abandonment, and sexual exploitations, they were only included in one study. So, right. And apart from asking older victims, older persons, as to whether they were abused, we have also attempted to have the indirect estimates of the prevalence of elder abuse. And compared to those direct estimates, the prevalence rates from indirect estimates ranging from 18 to 34%. And Right. In the study in Japan, it is a national survey of more than 4,000 people. And the researchers asked the participants whether they personally know an abuse victim. And 18% suggest that they knew an abuse victim personally. And in Korean population, the researchers asked 100 of older Koreans who moved to the U.S., and 34% saw or witnessed or heard about somebody in a social circle that had been an abuse victim, amounting to 46 incidents. And in a study conducted earlier, very early actually, in Hong Kong, so we look at proclivity to elder abuse. That is, we ask Chinese adults whether they would abuse an older person given there is no social consequence or given that there is no legislative consequences. And 1 in 5 persons indicate that they will abuse an older person if there's no such consequences. And if we look at the prevalence rates by geographic area, again, I need to point out that the result may not be comparable for reasons I mentioned earlier. And so in the People's Republic of China is between 35 and 40%, and in Hong Kong, 11 to 28%, Taiwan, 10 to 23%, and India is between 4 and 44%. I need to highlight that this study that conducted by United Nations in 2002, they only included physical violence and neglect, so the rate is pretty low. And in Japan, the studies that report on a prevalence of 18%, it only included 78 older persons. In South Korea, the sample size ranged from 500 to 1,003, and the reported rate is 6 to 38%. And finally, in Singapore, the rate is very, very low. The two studies, they actually, it's not exactly prevalent studies. The two studies, they actually trained attending physician in the emergency room to detect elder abuse. And that may be part of the reasons why the rates are extremely low. So the overall impression is that studies using larger representative sample, they tend to report low rates, and studies using convenient sample tend to report higher rates. But then it seems safe to project that about 10 to 15% of the population in Asia experienced elder abuse. And again, if we look at the prevalence rates at the vulnerable population, so we call it, the rate is much, much higher. So if we look at older persons with dementia, the rates range from 35 to 75%. And it's important to note that for these studies, we are actually asking the family caregivers whether they had abused an older persons. And in my study, which finds 62%, it was past month prevalence instead of past year. So it's consistent that older persons with physical or cognitive vulnerabilities or impairment, they tend to be, they were more likely to fall victims of abuse. The abusers, among studies that report on the kinship between the abusers and abuse victim, mostly were adult sons and daughters-in-law. So victims' response, most Asians, they demonstrate reluctance to report abuse. Several issues here. The first is they may not recognize the situation as elder abuse. Older Korean and older Indian, in particular, they tend to have high tolerance for financial abuse because it is common practice for older persons to transfer their property, their valuables to their younger son, to their adult children, in hopes that they would take care of them as they age, as they grow old. But in many cases, that does not happen. And then recognizing abuse and neglect is not related to help-seeking intention. In a study of older Korean, only 1/3 of the persons who label a situation, a hypothetical situation, as abuse indicated that they would seek help. And then in another studies in Japan, respondents actually indicate that they do not want non-family members to intervene in any family issues. And then there is the feelings of shame, fear of losing face, given that lots of the abusers were the adult child of the abuse victims. To admit that you were an elder abuse victim probably means that you brought up somebody who abused you. It probably means that you're bad parents. So lots of Asian people do not like to admit that they were elder abuse victims. And in a recent qualitative studies that I conducted, I interviewed older persons who spent time at a shelter. And interestingly, when I asked them whether they consider their experience elder abuse, 80%, 80, said no. It's bad times, my family's having bad times, it's family conflicts. And when I asked them if they have a friend or a family who have similar experience, will they intervene? Will they encourage the person to seek help? Will they refer the person to help? And again, 80% said no. So even for older persons who were able to recognize the situation as elder abuse, who want to seek help, many do not have enough information about the assistance available to elder abuse victims. And then, as I mentioned earlier, there is the negative attitudes towards involvement of non-family members because it's a family issue. So legislation and intervention efforts. On one hand, on the spectrum, we have countries that have mandatory reporting. In Japan, South Korea, and Taiwan, where it is legal responsibilities for healthcare professionals and for stakeholders who detect elder abuse to report it to the authority. And then in Japan and in Korea, we also have government-initiated efforts to intervene in elder abuse. For example, we have 24 hours hotline. We have elder abuse prevention center. And on the other end of spectrum, we have the People's Republic of China, Hong Kong, India, and Singapore, countries that do not have mandatory reporting, but we do have some legislation that try to promote the well-being of elder persons. In these countries, elder abuse preventive efforts mainly come from non-governmental organizations. In Hong Kong, for example, we use a case management approach, and we use a mediation program to intervene in elder abuse. But then, given it is from non-governmental organizations, funding is an issue, resources is an issue. So if we compare places which have mandatory reporting and places that do not have mandatory reporting, you can see that the reported number of abuse, they actually increase steadily over the years. So while legislation will not eliminate elder abuse, it actually encourages detection and identification of cases. So a summary of what my presentation is about. There is a lack of comparable data across populations and geographic areas, mainly because of the different definitions that we use and different methodological issues. And most studies rely on small representative sample. Diverse findings on prevalence rates ranging from 6 to 44%, and more common forms of abuse being psychological abuse and neglect, less common being sexual abuse and abandonment. And abuse is prevalent in older persons with physical and psychological impairment, likely abuser being the victim's grown-up children or daughters-in-law. And Asian communities were moving on different paces in terms of legislation and intervention efforts. And mandatory reporting in general leads to higher detection rates. So that is the end of my presentation. Thank you very much.
Thank you very much, Ms. Yan, and thank you, the three speakers, for keeping the time so that we will have about half an hour for questions and comments. I would like to ask you to be very brief, not statements, but more a brief comment or a question direct to the speakers.